Hi, everyone. Today we're going to be talking a little bit about speech therapy, what it is, and some resources for yourself or your children or anybody you might know in need of speech services, and a little bit of how to find out if you do need speech services. So my name is Sarah Bookout. I'm a speech language pathologist with experience working in early intervention, which is children birth to 3 years, working with teens and children, both through teletherapy and in-person services, and also adults and geriatric patients in a rehabilitation hospital setting. I graduated from the University of Northern Colorado with my master's degree, and I got my bachelor's at the University of Austin, Texas. So what we're going to talk about today is defining speech therapy and what a speech language pathologist does, talking a little bit about our scope of practice, all the different things we do, because it's a little bigger than maybe one might realize, and then kind of going more in depth in our services for children and adults, and then some resources to help you get more information on your own. So what is a speech language pathologist? Speech language pathologists are experts in communication. SLPs work with people of all ages, babies to adults, and we treat a variety of communication and swallowing problems. And that is pulled directly from the American Speech and Hearing Association, ASHA. So a little bit about what that means. Our scope of practice, we target speech, language, and swallowing, and that's very general. Really, we get into a whole wide variety of things that might fit under different domains, but this kind of summarizes it pretty well. So under speech, you might think of articulation, which is saying speech sounds correctly, your P's, T's, S's, R's. Fluency, so that means stuttering. Voice, that can be quality of voice, loudness of voice, that can pertain to teachers, educators, public speakers, singers, anybody who relies on their voice a lot and needs it to be at the best quality sounding for volume wise. If a teacher is talking to a room full of third graders, their voice might get burnt out pretty quickly. So we practice various strategies that help support vocal quality and health. Apraxia and dysarthria, so really that kind of boils down to motor speech disorders. You might be able to think of the word in your head, but as it comes out, the sounds may change. It might not be as clear or precise. Really just kind of intelligibility, how well other people can understand you. And we have different treatment strategies depending on the cause that's making the speech sounds less than clear. So next we have language. Under our language domain, we work with expressive and receptive language. So expressive language, how well you communicate with each other or with other people verbally and non-verbally. Gestures, facial expression, or spoken language in full grammatical sentences. Receptive language, following directions or understanding what is being said or read or interpreted through nonverbal language. Memory, so recalling information that you have learned recently. Usually we target short-term memory recall. So that could be phone numbers, addresses, directions, appointments, especially for our adult clientele. We work on, all those functional activities that are important for remaining independent and staying safe. So directions to the grocery store, remembering your checklist of things to do, sometimes even just remembering where you leave your keys, your masks, all that kind of stuff. We have strategies that target all of that. Cognition, so that can kind of summarize the next one too, executive functioning. So how we think and plan and problem solve, kind of maintaining our ability to limit ourselves from being too impulsive, to initiating conversation, to know when to terminate conversation. And then that also kind of leads into pragmatics, our social communication, things that are appropriate or inappropriate, And I'm trying to define this in a way that kind of encompasses adults as well as children. A lot of these, maybe you can think of children having a difficult time with expressive and receptive language, but also a big one can be pragmatics, especially with children who have autism, teens, adults, anybody with autism. Pragmatics is usually one that we really focus on to help build those social skills for jobs, for friendships, for all kinds of relationships. That one's a big one that we practice a lot of. Then lastly, it's kind of an outlier almost, is swallowing. So swallowing, we work on dysphagia, which is a swallowing disorder, and it can happen in the oral phase in your mouth, the pharyngeal phase in your throat, and then the esophageal phase in your esophagus. Usually a doctor, an ENT or an internalist might do some more work with esophageal dysphagia. There's not a whole lot we can do therapy-wise, but there's medications that help manage it and maybe some surgical options. But a lot of times we work on just making sure that the swallow is safe, different postural changes and strategies, or food texture alterations to make sure no food is aspirated, which is when food or liquid goes into the lungs and can cause aspiration pneumonia. And if somebody's already ill, adding that layer of pneumonia on top of it is just really something we want to avoid. Another thing we work on is the oral preparatory phase. So that, to me, that kind of includes setup of food, getting your food on a fork, getting your fork to your mouth, making sure you're able to keep the food in your mouth and not falling out. Postural changes. Sometimes we have clients who lean back a little bit. Maybe they're in a wheelchair or have a lot of weakness that it's difficult for them to sit upright. And that can lead to some of those aspiration moments of coughing or things going down the wrong way. And so we work a lot on positioning because it's something people don't even realize. And then food tolerance can be geared a little bit more towards children or young adults, even older adults too, not leaving them out, but a lot of times we see this in children. Textures can be difficult, so we work on kind of food and oral acceptance of different textures. And again, I started out kind of describing that in terms for adults, but that can also be related to children as well, and we'll get into that a little bit more. So speech therapy for children, just kind of an overview of what I do and a lot of my colleagues do specifically with children. Now, this isn't everything absolutely that's done by SLPs, but a good chunk of it. So the first one, fluency stuttering. There's various different types of stuttering. There's different severity levels. There's just all kinds of things that go into stuttering and a lot of methods that have been proven to really help alleviate moments of stuttering and decrease those bumpy sounds. Next, we have speech sound errors. Some good examples are R's, which are often produced as W's. So weed instead of read. S's, which sometimes can be heard as lateralized S's, where it's more of a Sarah instead of Sarah. So we work on positional changes of our articulators and to get that sound out a little bit more clearly. We also do expressive and receptive language delays. So a lot of times we'll see in our younger kiddos, maybe they're not talking by the age that we typically see kids talking, which every child is different. Every kid kind of learns on their own, but a lot of times if, around 18 months, almost 2 years old, if we're not hearing much in the way of vocabulary, if they are 2 years old and we don't hear any two-word utterances, then it might be time for some intervention, if not a little bit sooner. And then receptive language, again, is following those directions, understanding what is said. So if mom says, "Where's the dog?" Does the child point to the dog, or are they paying attention to what's being said? And then along with expressive receptive language delays, we do also kind of evaluate for hearing loss because that can sometimes attribute to that delay. Voice disorders. So a lot of times we've got kiddos who abuse their voice a little bit by yelling on the playground, yelling with siblings. It's just not uncommon, but not often treated just because, people think kids are kids and that's just kind of how their voice sounds. But there's always things we can work on if you hear that kind of rough or strained quality to their voice. Or if they have a harder time getting much volume, there might be some structural differences that are causing a difference in the pressure buildup that's required to project your voice or to be loud. Language structure, so kind of that grammatical sentence structure, along with expressive language and vocabulary. We also work on pronouns, identifying he, she, I, me, you, they. That can be hard. Even prepositions, sometimes, the kid might be trying to say the ball is in the basket, but they say the ball is on the basket. And so different little grammatical changes in language that change meaning. Those are things that we work on. And then reading comprehension. So can a child read a story and know how to answer all those important WH questions? Can they hear a story and know how to answer all those WH questions? And this all just kind of fits under speech and language therapy for children. So speech therapy for adults, same thing. We kind of have a lot of overlap. Fluency stuttering is with you forever. So if you're a child who stutters, you'll be an adult who also stutters, but there might be less or decreased moments of fluency or disfluency, I'm sorry, and might have more moments of fluency as you get older. But it's always, therapy is always available for anybody who needs some supportive strategies to help address fluency. Cognitive communication. So a lot of what I talked about earlier for swallowing and expressive language can fall under cognitive communication, from strokes, from traumatic brain injuries, from diseases, just kind of a myriad of things that can result in the need for speech therapy targeting cognition, memory, executive functioning, planning, problem solving, attention to detail, just really all those things that require a lot of thought and a little bit more attention than you might have realized prior to whatever incident caused this disruption in language. Next is speech sound errors. Adults can also have speech sound errors either from an incident or just something that was never treated as children, and that's also something we work on. Sometimes dental work or an accident involving the jaw can change the way speech sounds, and so we can work on that. A lot of times too, there are speech therapists who specialize in accent modification and actors who want to work on an accent specifically in one language that they have a hard time getting the hang of. Sometimes speech therapists also target that. Pragmatics, that can also be for children too. Brain injuries can change a lot of things, and it can impact somebody's ability to have a successful conversation with their peers or with their employers. And so that's a big thing to work on, just that social piece and kind of expected and unexpected behaviors, what's appropriate and not appropriate, that can be targeted and across all age groups, really. Expressive and receptive language, we've talked about that one. And then memory recall, some of those strategies to help make sure if there is memory loss stemming from whatever it may be, really practicing some strategies to help maintain safety and ability to complete daily activities as independently as possible. Okay, feeding and swallowing. This one's a little bit more in depth. So we have feeding and swallowing disorders with children. So really when I think of children, I think a little bit more of feeding. Think of newborn infants. A lot of times premature infants have some difficulties feeding. They may not have the suck, swallow, breathe pattern down that is essential for babies to be able to get the nutrition they need. And a lot of times too, it can be seen with pushing the liquid or the food back out of their mouth, gagging, coughing, or just some of that drooling of too much of whatever material they're trying to gain nutrients from. And anything that persists and is consistent and just abnormal is considered the disorder part. So, some of this is very typical for children, very typical for babies, but anything that persists too long and affecting the child's growth, then it's a disorder. So there are a variety of signs and symptoms that may be present, and it really requires a full evaluation through um, observation, different trials of different positioning, different trials of liquids, different trials of bottle nipples, depending on if it's an infant. We even see this in older children if they're maybe a cerebral palsy or sometimes autism. There's a lot of textural things that children are maybe adverse to. And so some of these feeding and swallowing disorders may be present. And I believe there's also I guess I would call it not a disorder, but it's something where the gag reflex is highly present in some people as opposed to others. And so that's something that may be targeted in children and adults. So swallowing disorders with adults, difficulty chewing, gagging, persistent coughing, food and liquid spilling from the mouth consistently, anything that may be a sign or symptom of aspiration. So everything or material going down the wrong pipe into the lungs, notably seen with coughing, that is considered a swallowing disorder. So there are many causes: traumatic brain injury, stroke, MS, Parkinson's, cerebral palsy, Alzheimer's disease, nerve damage, anything that impacts the sensation or the timing of the swallow, sometimes edentalism or lack of teeth or dental surgery. All of that can affect chewing and swallowing and maintaining safety when eating and drinking and maintaining a healthy weight. Those are all things that may be treated by a speech language pathologist. A speech language pathologist may evaluate this with a modified barium swallow study or a FEES. And one is an X-ray with barium in different textures and materials, and they watch with an X-ray to see if any material goes into the lungs. The FEES is a camera that goes up the nose, and they're able to get a picture pointing down in the back of the throat while food is trialed or liquid is trialed to make sure that there's control over the bolus and nothing goes into the airway. Okay, so that was a lot of information. But if any of this jumped out at you, if you feel like maybe your child is not talking, or maybe your child is talking, but some of their sounds are a little funny and don't sound like other children their age. If you have a teenager who, is having difficulty at school, maybe has been diagnosed with autism, that's having trouble making friends or building relationships or having conversations with anybody. If you're an adult that's had a stroke or a brain injury, or your dysfluency has increased because of COVID, stress, a new job, changes in your schedule. If you have an adult member in your family who's coughing a lot every time they eat or drink, these are all things that fall under speech therapy, and that I can give you some resources on how to gain some more information and decide if speech therapy intervention is something that you should pursue. So if you notice any of these red flags or concerns for yourself or children, check out the American Speech and Hearing Association website. Up here at the top, that's asha.org, and you can search the topic of your concern for additional information. If you feel like, oh, this might be speech related, this might not, this might be swallowing related, it might not, this is a really good resource that would give you some of that information. Then I would suggest contacting your primary care physician or your child's pediatrician for a referral. All speech and language clinics or places of work require referrals from a physician to begin an evaluation or treatment. And then contact your insurance provider to find an SLP in network and nearby. If you are self-pay, it's different, but a lot of times insurance is a little particular based on location and which insurance is accepted different places. So that will be your easiest way to find a good fit for yourself that is covered. And then if Marion Downs Center is in your network, give us a call to schedule an evaluation and or therapy sessions. Myself, I will be here all summer, and we have another speech language pathologist that is on site as well. So feel free to contact us with any questions you may have. And here's some resources. This top one is for stuttering, for autism, for brain injuries, and for voice disorders. These are just a few. There are so many out there under every single topic, but I thought these might be kind of the ones that are either most often searched at the top, stuttering and autism, and then maybe less often so, but very important, brain injuries and voice disorders. There's not a lot on voice disorders, but I know the need is out there, so I wanted to include these for whoever's listening. And thank you so much for joining me today and listening to my presentation. Please contact me at the Marion Downs Center if you have any questions or concerns. I'm always happy to give as much information as possible, and I'd love for you all to call and make an appointment if you feel like you need to do so. Thank you so much.